Suggestions from you experts who see these patients for convincing clients or friends to take a pet in for a pain assessment and or treatment. Common, what I call Heisman's, people putting up the hand to push you away would be, it costs too much, or, the animal's old. I'm not going to spend that money. That I'm thinking about just putting the pet to sleep. Are there any words of wisdom that you can share with colleagues and the audience here?
I think it's important that we acknowledge that arthritis is a chronic problem. Yes, we have to deal with it for a long time, and that can cost some money. A pain trial does not cost much. So to start wondering, is this going to help, is a really valid question. So we could start, for example, 2 weeks worth of or 3 weeks worth of Rimadyl and amantadine for about $50. So most people can go there. And I would always start with at least asking the question of this animal, will that help you change your quality of life? And then from there, we can take more steps. So in fact, that's how I start before any of my regenerative treatments, joint injection, shockwave, anything that costs a lot of money, because we want to see first, if we reset those maladaptive pain receptors, what this looks like. And you will be absolutely pleasantly surprised that they can come back to being, and people will say to me, years younger, because the pain has a much bigger effect than you think. And so it's not necessarily you have to do all the big treatments to get some pain relief and see how this is going to go.
Yeah, I think your point about the pain trial and actually somebody able to see a change can go a long way in starting that switch in their mindset. Mm-hmm. Great advice.